Hello friends, I am Dr. Brajesh. I am senior cardiologist in Fortis Hospital, Navi Mumbai. So today again we are going to talk on another interesting topic which is related to heart, that is the conduction defects. See, as we all know that heart is mainly supplied by two systems. One system is the system which supplies blood, that means nutrition to the heart. The other system is the system which supplies electricity to the heart. Now, why this is important? Now, we all know that the heart beats at a rate between 60 to 100 and it has got a particular rhythm. Now, this heart rate and rhythm is maintained by a conduction tissue, that is the electrical system of the heart. So, whenever there is a problem in this conduction tissue or the electrical system of the heart, patient can have problems. So, today we will deal with problems when the heart rate or the rhythm is on the lower side, what we call it as a bradycardias. Bradycardias means it's a syndromes of heart rate being on the lower side. So when the heart rate is on the lower side, the heart will pump at a lesser rate. So the organs which are supplied by heart may not get proper blood supply and they will have a problem in functioning. So the most common symptoms we feel in these patients are the sudden blackouts. These people fall suddenly, they lose consciousness, and many a time we see patients with the complications of blackouts. For example, they may have fractures, they can have head injuries, they can have multiple traumas. So these are the patients, they are presented to us either as a blackouts or they are admitted under other departments like neurosurgery for head injury, for orthopedic doctors, for fractures. So that is how we catch these patients. Now many a time very intelligent patients do come to us in OPD and they tell us that they feel sudden blackouts, they for few seconds they feel they lose touch with the world. So in these patients we start evaluating these patients for conduction defects. Now these are usually we see in patients with elderly age group, but yes, sometimes even younger patients can have this disease, but mainly it is seen in patients usually above 60 to 70 years of age. So how do we investigate these patients? So as we all know, the most important test is ECG, electrocardiogram, but sometimes the patient's condition is not picked up in ECG because it is important to have an ECG at the time when the patient has fallen down. I mean, it's possible that patient have a normal ECG most of the time except at the time when the patient has fallen down. So what we advise these patients is a Holter examination. Now this Holter examination can record heart rate for 24 hours, for 7 days, and in fact we have devices which can record heart rate and rhythm for a week, even for a month. So these type of devices are available which can be fit into the patient and we can record the rate and rhythm. So we can find out the hidden incidence of heart rate being lesser than 40 or lesser than 50. So I just wanted to show you one of the reports of a patient who has got a Holter. So this is an Holter. You can see it contains multiple pages and we are able to record the minimum heart rate, the maximum heart rate. It gives us multiple information including do the patient has a pauses in the heart rate. So by this Holter examination we can evaluate or we can record the incidence of the patient, whether during 24-hour recording the patient heart rate has fallen down less than 40. So the heart rate has a pause in between. Now if there's a pause in between, during that pause the brain will not get proper blood supply and they can have an episode of blackout or what we call it in scientific term as syncope. So once we diagnose these patients, how do we further go? Now if this patient has come in an emergency with the heart rate being very less, we usually do a temporary pacemaker. Temporary pacemaker is a small wire which goes through either your neck veins or through the groin and it goes into the heart and it is connected outside to a battery. So it makes sure it make the heart pump at a particular rate which is fixed by our battery. So that is temporary pacemaker. Now once we are sure that the heart rate less or the problem with the patient is a permanent, we need to have a permanent pacemaker. Sometimes even in temporary conditions, for example in kidney patients where there is an electrolyte imbalance, patient can have low heart rates. So once we correct that a temporary problem, we remove the temporary pacemaker as well. But most of the time we find that these patients have a permanent problem, they have a permanent conduction defects, so these patients will require a permanent pacemaker. So I just wanted to show you one of a pacemaker, this is an original pacemaker. You can say this is a pulse generator which is connected to a wire. Now this pacemaker goes, this wire goes into the from the pocket in the chest wall through the pipes into the heart, and this gets either screwed or it gets attached to the wall of the heart. So once it gets screwed to the heart, the wall, it conducts electricity from this pulse generator into the heart. We can fix the heart rate in these patients. This pacemaker is very intelligent. It can sense your movement and decide your heart rate based upon your movements. So with this advancement, this you can see there's only single wire. We have a dual chamber where we have two wires which passes two part of the heart, two chambers of the heart. In fact, with advancement, we have very small pacemakers, what we called as a micro pacemaker. It's also available where you don't have to make a pocket in the chest wall. It can be done through the leg. So all these facilities are available. Usually the life of these pacemakers are somewhere around 8 to 10 years. Some people may have 12 to 13 years depending upon whether the patient is dependent on pacemaker or not, because what happens over a period of time, 10 to 12 years, the battery drains away. So we'll have to change the battery in these patients. So we in Fortis Hospital, Navi Mumbai, we do a lot of cases of pacemaker. It's a very regular affair over here, and this hospital is famous for putting a good and quality pacemakers in the patients, and the results has been very good. Post pacemaker, patient usually stays for 4 to 6 hours in ICU. Next 2 to 3 days he is in the ward, and in 2 to 3 days time he is discharged, and patient absolutely becomes normal in rest of the life. Most of the time there are no precautions to be kept in future except few. Most of the pacemakers they are associated with guarantee warranty. They come with warranty. Their company people take care of the maintenance of the pacemaker. They regularly check the pacemaker. Initially first few months you can check it once in a month. Later on we usually advise once in a year pacemaker checking, and as the time comes when the battery is getting depleted, we frequently check the pacemaker, and before it get depleted we replace the batteries. So this is a technology, or this is the procedure where we put a pacemaker without giving a anesthesia to the patient. We give local anesthesia. Patient post procedure immediately can have tea, coffee, he can walk around. That is how it is, but it's very rewarding patient. It's very rewarding to the patients. They do very well, and ultimately they become mobile. They can go back to their work. They become, the tension of falling down gets over. So probably the pacemaker implantation in one of the most rewarding procedures in cardiology. And with the advancement, the newer and newer techniques coming, we are able to give best and best results to the patient. With the with the advancement, we have pacemakers which are a size of a small, very size of almost 5 centimeter, which can be implanted through the groin or femoral vein. So with this, I come to the end. Thank you very much for patience listening.